Mr. Jones? Hello, Mr. Jones.
Hello.
I'm Roshonda, one of the nurses at the facility. Please have a seat.
Okay.
Can you tell me a little bit about what brought you in today?
I just need to get my blood pressure under better control. I've noticed swelling in both of my feet, plus I haven't been sleeping too well lately.
I would like to gather more information about your current problems and also gather health information from you. Is that okay?
Yes.
If at any time I ask you a question that you prefer not to answer or that makes you feel uncomfortable, please let me know, okay?
Okay.
Do you have any drug or food allergies?
No, I don't have any drug or food allergies. I do suffer from seasonal allergies.
You mentioned that you're here because your blood pressure has been high, you've noticed swelling in both feet, and you haven't been sleeping well lately. Is that correct?
Yes, it is.
Do you take any prescribed medications?
I take Norvasc 10 milligrams. I haven't taken it for 5 years ever since I found out I've had high blood pressure.
Okay. Do you take any over-the-counter medications, such as herbs or vitamins?
No.
Do you take your Norvasc as prescribed, and how often do you take it?
Yes, I take my medication every day. I just don't understand why my blood pressure is still high. Maybe it's because of the stress at work and at home. With everything that's going on, I just can't sleep.
Tell me more about your sleep pattern. Do you go to bed early, and on average, how many hours do you usually sleep?
I usually go to bed around 9 p.m. Fall asleep easily. I just don't stay asleep. I wake up throughout the night. I get about 6 hours of sleep total.
What activities do you do for exercise?
Not much of anything anymore. After working all day, I'm too tired.
Do you have a support system, such as family members, friends, or coworkers?
My wife and my brother. I don't spend much time with anyone else outside of my family.
Do you attend church or some form of worship?
I am a Christian. I don't go to church much, but I pray often for myself and my family.
What activities do you participate in for relaxation?
I'm too stressed out for relaxation. I worry about so many things. I used to go fish a lot with my brother, but I don't do that anymore.
Tell me more about the stresses you've been having at work.
Well, at home, my wife has been fussing at me about hanging out with my brother and drinking beers. It's nothing. She is just making a big deal out of it. The stress at work is another story. The job can be very stressful at times. We don't know what's happening from one day to the next.
What type of work do you do?
I'm a crane operator.
Is it a physically hard job?
No.
Are you exposed to any hazards on the job?
No.
Does this job require you to bend a lot?
Sometimes. I mostly sit for long periods of time. I've noticed that my feet have started to swell when I'm at work. I have to load and unload when we are short-staffed, and it doesn't help that my back bothers me at times.
Is this a recent injury?
No. I injured my back about 10 years ago, and I was unable to work for a while. It was hard on the family when I was out of work, so I don't complain about anything at work. I need my job. We have no health insurance. There are constant threats about layoffs, which concerns me. I'm married with 2 kids. At this rate, I don't even know if I will be able to afford college for my kids.
You stated that you sit for long periods of time at work, and that you noticed that your feet have started to swell when you're at work. Is that correct?
Yes.
Do you notice the swelling only when you're at work or when you're at home as well?
No, just when I'm at work.
Have you tried anything to reduce the swelling?
Yes, at night I prop both of my feet up with 2 pillows and the swelling goes down.
Have you noticed any pain, numbness, tingling, burning associated with the swelling?
No.
Are you experiencing any back pain right now?
Yes, a little.
On a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you've ever felt, how would you rate your pain right now?
About a 2.
How would you describe the pain?
Kind of an aching pain.
Is the pain constant or does it come and go?
Comes and goes.
Does anything make the pain better?
Tylenol and rest.
Does anything make the pain worse?
Usually sitting for a long period of time or heavy lifting.
Do you experience any nausea or vomiting, weakness, or sleeplessness associated with the back pain?
I have weakness at times.
I can understand how the stressors at work and at home and the intermittent back pain can cause you stress. Has drinking been a stress reliever for you?
Not really. When me and my brother get together, we just drink and talk.
Have you ever felt you should cut down on your drinking?
No, I only drink about 6 to 7 beers.
Do people annoy you or criticize your drinking?
Yes, because it's not a problem for me. My brother, on the other hand, drinks too much. My grandfather also had a drinking problem, but it's not a problem for me. I only drink on the weekends.
Have you ever felt bad or guilty about your drinking?
Only when my wife nags and my kids hear us arguing.
Have you ever had a drink first thing in the morning to steady your nerves or to get rid of a hangover?
No.
Thank you for being open and sharing your drinking history with me. Now I'd like to gather information about your health history. When was the last time you had a physical exam?
It's been almost 10 months.
Are your immunizations current?
I'm not sure.
Have you traveled outside of the United States?
No.
Have you had a screening for colon cancer?
No.
Testicular cancer?
No.
Prostate cancer?
No.
Skin cancer?
No.
When was the last time you had your cholesterol checked?
I'm not sure.
When was the last time you had your blood glucose level checked? It's a test for diabetes.
I don't know.
When was your last dental or eye exam?
I haven't had a dental or eye exam in over 10 years.
Have you had any surgeries?
I had an appendectomy when I was 19 years old.
You're married, correct?
Yes.
Any history of sexually transmitted diseases?
No, I've been faithfully married for 30 years.
Let's review your family history. Are both of your parents still living?
Yes.
Do you have any immediate family members who have chronic diseases such as heart disease, diabetes, high blood pressure, or high cholesterol?
Yes, my dad is 76 and has high blood pressure. And he had a stroke when he was 60. My mom is 75 and she has high blood pressure and diabetes. I have one brother who also has high blood pressure and diabetes.
What's your regular diet like?
I don't really follow any diet. My wife bakes a lot of fish and chicken, plus we eat a lot of vegetables. However, when I'm at work, I pretty much eat whatever I want. Usually drive-through burgers and fries. I'm trying to cut back, but I put salt on everything. I would like for you to give me advice on healthier eating habits.
Yes, sir. After I complete this assessment, we'll review a diet plan for you, okay?
Yes, thank you.
Aside from the high blood pressure, back injury, and seasonal allergies, do you have any other health issues?
I experienced some chest pains in the past, but I saw a cardiologist and he said that I was okay.
Have you had any recent episodes of chest pain, pressure, or tightness?
No.
Any shortness of breath?
No.
You mentioned that you drink alcohol. Do you smoke cigarettes or use any recreational drugs?
Yes, I drink beer, but I don't use any drugs, and I quit smoking 2 years ago.
That's very good, Mr. Jones. I'm glad to hear that. Now I'm going to perform a physical assessment on you. Is that okay?
Yes.
During the assessment, I'll be touching parts of your body. I'll be mindful of your dignity and respect you.
Okay.
At any time I touch any part of your body that makes you feel uncomfortable, please let me know, okay?
Okay.
All right, thank you. I'm going to wash my hands. And I'll gather my supplies. Okay, Mr. Jones, doing the assessment. I'm going to be touching parts of your body. I'm going to start off with your head first, and I'm going to work my way down. As I said, if I touch you any way that makes you feel uncomfortable, please let me know, okay?
Okay.
First, I'll start off by examining your head for symmetry, making sure there's no bumps, bruises, knots, any pain when I touch.
No.
Touching your frontal lobe bones, parietal, occipital, temporal, everything looks good. Okay, checking your sinuses, any pain when I press there?
No.
Okay, open your jaw or mouth for me, close, any pain when you do that?
No.
Do that again for me. Okay, looks good. Any pain when I press along here?
No.
Any problems with breathing?
No.
Any sneezing?
No.
Okay, can you open your eyes for me, Mr. Jones? Follow my finger. Okay. Can you look up for me? And look down. Alrighty. Gonna check your ears. No drainage or anything. Any problems with hearing?
No.
Do you hear me?
Yes.
You hear me?
Yes.
Hear me?
Yes.
Hear me?
Yes.
Can you smile for me? Okay, nice smile, symmetry. Okay, close your eyes for me, please. Tell me when you touch me. When you feel me touch you, I'm sorry.
feel, 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 feel.
Okay. Gonna be checking your lymph nodes for swelling or tenderness. Let me know if you feel any pain there. Okay. Sorry if my hands are a little cold. Okay. Is that all right, Mr. Jones?
Yes.
Okay. Can you hold your head up for me? Trachea's midline. Turn to the left for me. Okay. To the right. All right. Lift your head all the way up and all the way down. Checking the flexion of your neck. Any pain when you do that?
No.
Okay. Hold head back up for me. Thank you. Get your collarbone there. Okay. Now swallow for me. Any problems or difficulty when you swallow?
No.
Okay, sounds good. Mr. Jones, you told me that it's been about 10 years since you had an eye exam. Is that correct?
Correct.
Okay, I want you to take a look at a chart for me. Can you stand for me, please?
Yes.
Okay, put your hand over your right eye. And I want you to read the line that you can, the smallest line that you can. And when you're ready, you can go.
E, F, T, P, D, C.
That's correct. Change hands, please, and eyes. There you go. Read the smallest line that you can.
E, F, T, P, D, C.
Good. Uncover both eyes and read for me.
E, F, T, P, D, C.
Good. Okay, sit for me, Mr. Jones. Thank you. Okay. I'm gonna check your fingertips for cupping. There's none. Capillary refill is good. Okay. All right, checking your pulses. All right, lift this arm up against me. There you go. Lift this arm up against me. There you go. That is good. Gonna do some touch sensation.
Okay.
Okay, this is sharp, this is dull. Close your eyes for me and let me know what you feel.
Sharp, dull, dull, sharp.
Okay, thank you, sir. Now I'm going to take a listen to your heart and lungs. Okay, you can breathe normally. Okay, I'm going to take a listen to your temporal lobes here. Listening for any bruits or abnormal sounds, none heard. Okay, can you turn your head to the left for me, sides for me? Thank you, sir. Okay, other side. Alrighty, thank you. I'm going to take a listen to your lungs. Take a deep breath for me. And out, yeah. Again. Again. Last time. Okay. Listen to your lungs to the front here. Take a deep breath in and out for me. And again. Okay. You can breathe normally. Mr. Jones, if you could, please for me, lay back. I want to take the inspection of your abdomen, your tummy. Okay. Any pain in your belly when I touch?
No.
Nope. Okay. Any nausea, vomiting, diarrhea? Any upset stomach?
No.
Okay. I'm going to take a listen to your apical pulse real quick and check your radial pulse at the same time, okay?
Okay.
Okay. Now, Mr. Jones, I'll take a listen to your abdominal sounds. Okay. Mr. Jones, do you have any problems with urination? Any problems with frequency, starting or stopping urination?
No.
Any blood in your urine?
No.
Any cloudy urine?
No.
Does it hurt to urinate?
No.
Okay. Any changes with your stools? You notice any blood in your stools?
No.
No constipation?
No.
Okay. Thank you. Okay, I want you to lift this leg up against me. There you go. Lift this one. Alright, I'm going to do the same test I did with the arms, and you tell me what you feel. Sharp or dull?
Dull. Dull. Sharp. Sharp.
Thank you, sir. I'm going to check your pedal pulses here. And you do have a little bit of swelling, Mr. Jones, as you indicated, around your ankles, okay?
Okay.
Alrighty, can you sit up for me? Thank you, sir. I want to get a reading of your vital signs, okay, Mr. Jones? Please slide your arm in for me. Okay, just relax your arm. Thank you. Thank you, sir. Already check your pulse, so I will check your temperature now. Do your tongue. Thank you. Thank you. I was checking your respirations. Can you stand for me, Mr. Jones, when I get measurement of your waist circumference? Thank you, sir. Alrighty, thank you. Can you step on the scale for me? Okay, thank you. You can have a seat. Now we'll discuss the diet plan that you had requested. Okay? This is what you ought to do